Hello, my name's Jeff and I'm a BSN student at Nevada State College. Today we're going to perform a comprehensive physical exam on Miss Angie here. Clean my hands. Today is November 29th. And please introduce yourself.
My name is A.B. and I was born on June 12, 1957.
And what's your
and
occupation?
I am a chief nursing officer at one of the local rehab hospitals in Vegas.
And how would you rate your general health?
Pretty good.
And give me some family medical history.
Family medical history or my history first, sir?
Whichever you prefer.
I have a history of mild hypertension and hypothyroidism. Family history includes, on my father's side is hypertension and mother's side is arthritis. I have a surgical history of a tonsillectomy in 1995, left shoulder arthroscopy in 2010, and a left hallux valgus repair in 2009.
And what do you do for physical activity?
I occasionally exercise, probably once or twice a week on a treadmill.
And what do you do for stress relief?
I go for massage twice a month, and I work 24/7.
And what do you do for occasional fun?
I go spend time in the casinos for fun.
I see. What's the hardest part of your job?
The hardest part of my job is I'm a 24/7, which I only have a few days off a month. I work all day. I walk all day, which sometimes give me leg cramps, but it doesn't impede my activities of daily living.
I see.
No pain, no stiffness.
I see. When's the last time you had a physical checkup?
Last year in 2011.
Good. Well, you're about to get a comprehensive physical exam today. So let me look at you generally. You're sitting up straight, posture is good, comfortable, hands relaxed side, and your head is faced towards the examiner. Your facial features are symmetrical with movement, and your expression is comfortable, and your skin looks olive color, tone throughout, pigmentation that of Filipino origin. Nutrition wise, it looks like clinically there's no findings to suggest that you're overweight. Your body fat is evenly distributed, and your weight is appropriate for your height and build. And speech wise, it's very articulate, understandable, and appropriate. And your mood and affect looks like you're cooperative and appropriate for the exam. Let's see, we're going to begin today with your head and your face. Your face appears to be smooth, olive tone throughout, no lesions. Tergo is good, good mobility. And let's look at your hair. Your hair is thick, black, tints of blonde. Scalp-wise, there's fine graying, light graying here. But otherwise, your hair is very fine and beautiful, I might add. Next, we're going to go over your eyes. Your pupil size is 3 mm. Now focus on a distant object. And now focus on my hand. Again, focus on a distant object. And focus on my finger. Okay. Looks like your orbit, your cornea, your iris are all normal. Your eyelids, your eyebrows are equal bilaterally. Let's look at your lacrimal apparatus. No excess fluid, no swelling. Next, we're going to look at your nose. It's midline. Sniff in. Patency is equal bilaterally. Now we're going to do a smell test as well. Cranial nerve number 1. Close your eyes. Take a small sniff. What do you smell?
Cinnamon.
And the other one as well.
Same thing, cinnamon.
Okay, good. Cranial nerve number 1 is intact. Next we're going to look at is your mouth. Lips look pink. No cracking, no lesions. Open up your mouth. Stick out your tongue. Tongue is midline, pink as well. Say ah.
Ah.
Stick your tongue out. Stick your tongue out. Ah.
Ah.
Gag reflex. Okay. Gag reflex is intact. That's cranial nerve number 12. And let's see, clench your teeth. Clench your teeth. Looks like your teeth are also normal occlusion, top and bottom. White throughout, even except a little distortion in the front. Open again. Looks like your molars, top and bottom, perhaps number 1, 2, and 3 are missing throughout. Look at your gums. Your gums are pink as well. No bleeding, no discoloration. Midline tight. Let's look at your tonsils. Stick your tongue out. Stick your tongue out, please. Oops, sorry.
Ah.
Uvula is midline and tonsils absent. Next is your ears. Skin color is the same. Skin condition is the same. Configuration normal bilaterally. No earwax, cerumen, both canals. Your teres auricle, no tenderness, no redness. Auditory meatus looks fine. And the other side, same thing. Next, I'm going to palpate your lymph nodes. So what I've done there is I've palpated your auricular, pre and post, occipital, jugular-gastric, your submandibular, your submental, your cervical chain, your deep ones, your posterior ones, and also your subclavicular nodes. No palpable nodes noted. Next is your neck. Trachea is midline. No thyroid enlargement noted. Again, your neck is midline. Let's do range of motion for your neck. Put your chin down, please, to your chest. Then upward, left, and right. Now let's do it against resistance. Ready? Down, up, left, and right. No abnormalities noted. Range of motion, strong, symmetrical, and even. So shrug your shoulders. Good. Clench your teeth. Puff your cheeks. Smile. Raise your eyebrows. Squeeze your teeth. And squeeze your eyes. Close your eyes. Good. So those cranial nerves are working as well. Now I'm going to check your sinuses. Keep your eyes closed. No pain?
No pain.
No pain?
No pain.
Good. Next I'm going to check your TMJ. Open your jaw. Move your jaw left and right, in front and back. Good. No pain?
No pain.
No crepitus noted. And range of motion style is great. Cranial nerve number 5 is intact. Let's see, the next I'm going to go to is your breathing. Respirations are even, unlabored, relaxed, and 18 respirations a minute. deep breaths for me. Again. 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 Okay, relax. So what I've noticed here is some bronchial, tracheal sounds. In this area, some bronchial vesicular sounds. And then out here, some vesicular sounds as well. AP to transverse chest ratio is about 1 to 2. No deformities noted. No heaves, lifts, or pulsations noted on anterior chest. Now I'm going to listen to your lung sounds in the back. Can you please turn to your left hand sheet? Good. And I'm going to drop this a little. And take a breath slowly. Good. No adventitious sounds noted. Again, normal breathing, normal breath sounds, vesicular. I'll turn to the left as well again. I'm going to check your posterior chest expansion. So when I ask you to say ah, take a deep breath in. Ready? Go. Okay, one more time. Good. No abnormalities there. Also, I wanted to check your spine straight. Spine is straight. Now we have to drop this. I'm going to check your heart. Cardio. Maybe you should lay down. Okay, if it takes me a little longer while I'm listening, it's not because there's anything wrong, it's just because I'm listening for all the sounds, okay? rate is 70 beats per minute. Rhythm is normal, even. What I did here is I listened to your, on your right of your sternum, second inner space to the right is your aortic valve area. Then I listened to your pulmonic valve area, which is your second inner space on the left side. And then Erb's point is in the third inner space, left of the mid-sternum. Then your tricuspid is down here on the left sternum border, and your mitral valve is over here on the fifth inner space, left of the mid-clavicular line. Again, on the anterior chest, no pulsations, no heaves, no lifts. Next, I'm going to check your abdomen. Inspection shows no masses, no bulging, smooth, even skin, stria in this area. That's I'm going to auscultate for vowel sounds in all four quadrants. And vowel sounds are present in all four quadrants. Next I'm going to do is the percussion. Then I'm going to do light and deep palpation. No masses, no lesions. Now I'm going to go a little deeper. Palpation. No enlargement of any organs or masses noted. Okay, sit up for me, Angie. Squeeze my hands, please. And symmetrical, even, bilaterally. I'm going to check your resistance. Push down, equal, symmetrical. Skin tone is even throughout. No edema, no temperature. Capillary refill. Less than 3 seconds. Do range of motion on your arms. Up, down, bend your shoulders. Bend your hands in. Shrug your shoulders. Good. Looking at your legs also. No temperature noted. No edema. Wiggle your toes. Lift your legs up one by one. And down. Good. Next I'm going to check is your CVA. Is there any tenderness in your costovertebral angle? Feel any pain?
Nope.
No tenderness noted. Next is your deep tendon reflexes. And this will be your bicep. Okay, +2, 2+ response. Normal. And that's also +2, normal, so equal bilateral and symmetrical. Next is your patellar. +2 normal response as well. +2, 2+
normal response as well. So bilateral, symmetrical, normal responses. Next I'll check is your Achilles. Go ahead and dorsiflex your foot. Two plus response, normal, and your other, dorsiflex. 2 plus normal response, so bilateral, symmetrical as well. And my last deep tendon reflex is your tricep. Let your arm go dead. +2 normal response. And your other one, let your arm go dead again. +2, 2 plus normal response. So equal, symmetrical, both of those. Next I'm going to check your pulses. Check your radial pulse. So 36 in 30 seconds times 2 would be 72. 72 beats per minute. Now let me check your, put both legs up here. Let me check your dorsalis pedis. And those are 40 symmetrical, equal, bilateral. So 40 times 2, 80 beats per minute down there, a little strong. Next is going to be your posterior tibia pulses. In 30 seconds, those are 38s, so 76. Okay, relax for a minute, sit up straight, see if I got everything. Okay, stand up for me. Next thing I'm going to do is check your spine. It looks straight and even. Hang on a second. Stay up straight again. Spine is straight, even. Let me tie you up in the back. I want you to stand there, close your eyes. I'm going to do the Romberg check. Don't hold on to nothing. Move off left. And you stay this way for 20 seconds. Eyes closed. And test is negative. Next, slowly reach down, touch your toes. C-shaped spine. Looks symmetrical. Stand back up. Range of movement. Seems to be smooth, coordinated. No pain. No pain.
No pain.
Okay. Bend to the left and to the right. Raise your right leg. and your left leg. Good. Range of motion appears to be symmetrical, smooth movements. Now I'm going to ask you to walk down this area and back. Gait appears to be smooth, coordinated, arms are coordinated, straight, symmetrical, effortless, and balanced. Well, I believe that concludes your physical assessment for today.